On February 3rd, 2009, Tom Daschle, President Obama's nominee for Secretary of Health and Human Services, withdrew his nomination because he hadn't paid his taxes on his car service. On January 9th, 2001, Linda Chavez, President George W. Bush's nominee for the Department of Labor, withdrew her nomination after questions were raised about her decision to shelter an undocumented immigrant. And most recently, Vincent Viola, President Trump's nominee to be the Secretary of the Army, withdrew his nomination after it proved too difficult for him to distance himself from his business ties. Congressman Price's conflicted financial investments and his affiliation with conspiracy theory peddling extremists should be enough to disqualify his nomination. But on top of that, Congressman Price's policy agenda squarely contradicts what the majority of American people want and the key promises that President Trump made during his campaign. It's frankly hard to believe that we are seriously considering someone who has advanced policies that would privatize Medicare, gut Medicaid, and rip coverage away from millions of Americans. For all of these reasons, I strongly oppose Congressman Price's nomination for Secretary of Health and Human Services. Now, let's take these issues one by one. First, Congressman Price's stock trades. Public documents show that between 1993 and 2012, Congressman Price owned shares in tobacco companies worth tens of thousands of dollars. At the same time, Congressman Price voted against landmark legislation in 2009 that gave the Food and Drug Administration the authority to regulate tobacco and bring down the death toll inflicted by tobacco products. That means Congressman Price, a physician who swore to uphold the Hippocratic Oath of do no harm, voted against public health and for big tobacco. This is the person who is slated to become the next Secretary of Health and Human Services, someone who personally profited from increased sales of deadly, addictive products. When asked about this during his hearing in the Health, Education, Labor, and Pensions Committee, Congressman Price's best defense was that his broker made these stock trades on his behalf without his knowledge. But here is the problem with that defense. First, Congressman Price annually reported his financial holdings, signing off on documents acknowledging that his investments in tobacco companies, meaning that he would have knowledge of the fact that his vote to block tobacco regulation could have a direct financial benefit to him. Now, let's talk about one example that is particularly troubling. Congressman Price made his largest ever stock purchase in a company called Innate Immunotherapeutics, a small biotech company based in Australia. This is a company that has only one experimental therapy in the early stages of testing, has never generated revenues from drug sales. It's not exactly a household name. So how did Congressman Price get in on this sweetheart deal? Well, he was told about Innate by Congressman Chris Collins, who, in addition to being a member of the House of Representatives, serves on the board of directors for Innate Immunotherapeutics and is the company's largest shareholder. The Wall Street Journal reported that Congressman Price was part of a small group of fewer than 20 U.S. investors who participated in the private stock sale. The New York Times and the Buffalo News reported that many of those people had close ties to Congressman Collins, including Collins' chief of staff, a prominent D.C. lobbyist, and several of Congressman Collins' campaign contributors. On August 31st, Congressman Price reported that as part of the special private stock sale, he bought about 400,000 shares of an 8 stock for as little as 18 cents a share. That same day, the stock was trading on the Australian Stock Exchange for the equivalent of 31 cents per share. That's a 42% difference, 42% below the market price. And Congressman Price now stands to make a profit of more than $200,000. That's quite a stock tip. Richard Painter, George W. Bush's chief ethics lawyer, describes Price's stock trades as, quote, crazy. We wouldn't have put up with anybody in the Bush administration buying and selling healthcare stocks, end quote. Painter went on to explain that, quote, if you as a member of Congress buy and sell healthcare stocks at the same time, you are possessing non-public information about that legislation. You are taking the risk of being charged with criminal insider trading. Criminal insider trading, end quote. So let me repeat that. Mr. Painter, who was George W. Bush's White House chief ethics official, suggested that Mr. Price's actions risk a criminal insider trading charge. Now, Congressman Price could have directed his broker to stay away from tobacco stocks. He could have directed his broker to stay away from healthcare stocks or individual stocks altogether, given that healthcare was one of his legislative priorities. But he did not. Why would Congressman Price take this risk? My colleagues and I have sent Congressman Price a number of letters asking for more information about his stock trades and investments. If this is all above board, then Congressman Price should have nothing to hide. I also submitted questions for the record as a member of the Help Committee. In response to all of these questions, I have received nothing. It makes no sense that his nomination has been brought to the floor despite his refusal to respond to committee questions. Congressman Price has demonstrated a lack of judgment with his stock trades and now is stonewalling the committee, refusing to answer our inquiries. But Congressman Price's questionable stock trades aren't the only area raising red flags. My second set of concerns stem from Congressman Price's longstanding association with conspiracy peddling anti-science extremists for more than 25 years. Congressman Price has been a dues-paying member of the Association of American Physicians and Surgeons. He's spoken at the organization's conferences and even described the organization's executive director as one of his personal heroes. This organization is way out of the mainstream. It promotes anti-vaccine pseudoscience and denies the scientific fact that HIV causes AIDS. It's an organization that blames, quote, swarms of immigrant children for disease and has published scientifically discredited theories linking abortion to breast cancer. At one point, it even accused President Barack Obama of hypnotizing voters with, quote, neuro-linguistic programming. Let me repeat that. It accused President Barack Obama of hypnotizing voters with, quote, neuro-linguistic programming. But that's not all. The Statement of Principles for the Association of American Physicians and Surgeons has an entire section devoted to urging doctors to refuse to participate in Medicare, in which it says the effect of such government-run programs is, quote, evil, and participation in carrying out its provisions is, in our opinion, immoral, end quote. Congressman Price, the person poised to become the next Secretary of Health and Human Services, the person responsible for leading Medicare, has been an active, engaged member of this organization for 25 years. Just in case you don't think he's bought into these ideas, let me read you what Congressman Price wrote in 2009 in an op-ed. Quote, I can attest that nothing has had a greater negative effect on the delivery of health care than the federal government's intrusion into medicine through Medicare, unquote. Since Congressman Price won't answer my questions, I'll pose this one to my Republican colleagues. How are the American people supposed to trust Congressman Price as Secretary for Health and Human Services, given that he's belonged to an organization for over 25 years that has such blatant disregard for science and a propensity for putting partisanship and ideology above evidence? Lastly, and most importantly, the policy reforms that Congressman Price has put forward are so extreme that they should be disqualifying in and of themselves. An editorial recently published in the New England Journal of Medicine stated, and this is a quote, as compared with his predecessor's actions, Price's record demonstrates less concern for the sick, the poor, and the health of the public, and much greater concern for the economic well-being of their physician caregivers, end quote, from the New England Journal of Medicine. And, Mr. President, I ask consent to enter that article into the record.
Without objection.
Thank you, Mr. President. This article cites his votes against mental health parity. Think about what that means in terms of treatment during this opioid crisis. Against funding for AIDS, malaria, and tuberculosis. Against the expansion of the state children's health insurance program, SCHIP. Against tobacco regulation. Against the reauthorization of the Violence Against Women Act, and more. Price has also been a champion of efforts to repeal the Affordable Care Act. The Congressional Budget Office recently estimated that if the ACA is repealed, nearly 20 million Americans will lose their health care coverage immediately, with the number growing to 32 million over the next 10 years. 300,000 of those individuals live in my state of Minnesota. And let me tell you about at least two of them. Leanna has a 3-year-old son named Henry. Henry has been diagnosed with acute lymphoblastic leukemia, and his treatment will last at least until April of 2018. Henry often needs around-the-clock care to manage his nausea, vomiting, pain, and sleepless nights. This is a 3-year-old boy. 3-year-old boy. Henry's immune system is so compromised that he's not supposed to go to daycare. So Leanna left her job to take care of him. Leanna's family is supported by her spouse, but they couldn't pay for Henry's treatment on one salary. Leanna says, and I quote, "It is because of the ACA that Henry gets proper health care. Henry can get therapy and the things he needs to maintain his health and work towards beating cancer. Henry is still with us because of the ACA." Unquote. Let me say that again. Henry is still with us because of the ACA. I've asked Republicans repeatedly to show me the plan they have to make sure that Leanna and her son Henry and the hundreds of thousands of Minnesotans who have gained coverage don't lose the care that they need. I have yet to see their plan. What I have seen Congressman Price advocate for so far is pretty awful. His proposals would strip away coverage for people with pre-existing conditions, strip away preventive health benefits, strip away protections from annual and lifetime limits, and strip away coverage for young adults. Moreover, Congressman Price views Medicaid and Medicare as government expenditures to be cut, rather than lifelines to millions of seniors, disabled populations, children, and families. As chairman of the House Budget Committee, Congressman Price introduced proposals to cut funding for Medicaid by more than $2 trillion. In my state, Medicaid provides health insurance to 14% of the residents. That includes 2 out of 5 low-income individuals, 1 in 4 children, 1 in 2 people with disabilities, and 1 in 2 nursing home residents. Think about that. 1 in 2 people in nursing homes are covered by Medicaid in my state. What is going to happen to these people? Our parents, our children, our spouses, our families, if Congressman Price and his colleagues succeed in slashing Medicaid's budget. I can guarantee you it won't be kind and it won't be just, and Americans are going to lose out. Congressman Price's assault on our health system doesn't end there. He wants to slash Medicare's budget by hundreds of billions of dollars, undermining our basic guarantee of coverage to our nation's seniors. And no wonder, because let me remind you, this is the same person who wrote, quote, "I can attest that nothing has had a greater negative effect on the delivery of health care than the federal government's intrusion into medicine through Medicare," unquote. Do we really want the person who wrote this to be running Medicare? Price's determination to gut Medicaid and Medicare is directly opposed by the vast majority of Americans, and in direct opposition to President Trump's campaign promise never to cut Medicaid or Medicare. When Tom Daschle withdrew from consideration for HHS secretary, He talked about the challenges of health care reform and said, quote, "This work will require a leader who can operate with the full faith of Congress and the American people and without distraction. Right now, I am not that leader and will not be a distraction." So I say to Congressman Price, you do not have the full faith of the Congress, and you do not have the full faith of the American people. You are not the leader that this country needs, and you should not be a distraction. And since you have not withdrawn your nomination, I urge my colleagues to do the right thing and oppose this controversial nomination. I would suggest the AAPS. So, no, I would yield the from Hawaii.